This is Dr. Rachel Viner with Family First Chiropractic in Andover. This video is to show how I work with women during their pregnancy for an adjustment. This mom is 23 weeks pregnant, and we are using special pillows that have the middle cut out so mom is able to lay on her stomach for a better adjustment. The first thing that we do is the leg check. This allows me to see if one leg is shorter than the other. It doesn't mean that the leg is actually anatomically short, but it does show me if something's going on in the hips. I then use a massager on the lower back to relax the muscles before we do any kind of adjusting. This is completely safe for mommy and baby. After using the massager, I go back to double check those leg lengths. This allows me to make sure that the results I had before are the same. I then go and check the upper back to see if there's anything that isn't moving, which we call palpating. In my office, we use table drops. With table drops, basically the pelvic part of the table comes up just a little bit, about an inch or so. So that way when I put pressure on the SI joint, which is your sacroiliac joint, there is movement there and I'm not pushing you straight into a table. This again makes it safe for baby and for mom. Patient is talking to me about some right lower back tightness. This is above the right SI that I just adjusted. We'll get to that in a little bit later. But now I'm going up and I'm making sure that each vertebrae above and below are moving well. If one isn't moving as well, then I do adjust it. My adjustments are gentle but effective. I want to make sure we have some movement, but I don't want to push too hard. After being adjusted in the upper back, most patients state that they can feel looser and that they're able to breathe a little bit deeper. During the end of every pregnancy, that is one of the biggest complaints that I have, is that moms aren't able to breathe as well, and that's just from the pressure of the baby. One final leg check to make sure everything's okay. After that, I have the patient slowly take her time getting up so that way I can remove the pillows. She was still complaining about right lower back tightness, so I do have her lay on her left side so her right side is up, so we can do what's called side posture. This allows a little bit more movement in that lower back. I then try to find the segment that's still causing her some right lower back discomfort and tightness. When I find it, I do give a slight adjustment. I then ask her to lay face up for me. With patient laying face up, I do a leg pull, which basically decompresses that lower back and right hip to get some more movement there. I then check her pubic symphysis by having her push out against my hands and then pushing in against my hands. Any pain, and I would go ahead and adjust it, but she's not having any, so I go ahead and go up to check her neck. This patient is prone to getting headaches. Most of the time, it seems to come from tension in her neck, but sometimes it can be due to allergies or sinus issues. So checking her neck, I make sure that everything's aligned, and if I feel anything out of place, I do go ahead and do a gentle, again, but effective adjustment. More of a lateral bend than any kind of rotation into the neck. After double checking my work in the neck, I then go and start my round ligament check. To find the round ligaments, I use the belly button, the ASIS, and the pubic symphysis, and we make a triangle, and it's right kind of in the middle of the triangle on the underside of the swell of the belly. I normally don't worry about this until the 3rd trimester unless a mom is telling me that she is starting to already have pain there. That's the end of my video. If you have any questions, please reach us at Dr. Rachel at familychiroks.com. That's DRRACHEL at FAMILYCHIROKS.com, or give us a call at 316-712-4136. Thanks.